Hello, this is Dr. Lorenz at Longevity Health Institute. I hope this is finding you well. I'm going to tell you about my day because it was a good day. Every day in medicine's a good day. Love helping people, doing the right thing. And, here, privileged to take care of you in a functional, personalized, preventative way. Gosh, man, it couldn't be more of a blessing and exciting. And, just love what I do, love helping people. But I want to share because, of course, every day is different, challenging days, struggle days, busy days, being pulled directions, what have you. Today was a great day because there's a lot of great stories, a lot of good people coming back. I love my relationships with patients, and I was able to, follow up some of them, some I hadn't seen in a while, and just some great stuff. So I had to kind of cheat and take my schedule here, and I have to, read it to you, but just to share with you a few things. 60-year-old guy, first patient of the day. Great guy, man. I got to just tell you, what was amazing about him is he retired last year, and I went, whoa, we're not retired. You can slow down, but men are prefrontal cortex, frontal lobe driven. We need purpose. We need to go. We need to provide. We need to, seek, if you will, and achieve. And retirement is usually not a good thing. It can often be a little bit of a bad ending. He got very anxious, gained a lot of weight. Gratefully, he's back to work, just as a contracted job, working a little bit. He says he's working a little bit too much, but he's got a lot of freedom when he wants to leave and go to Florida and stuff like that. But he was doing great. Still got to work on his weight a bit. But, he's happy, and he literally had anxiety after his retirement. So that was really cool follow-up. Another one was a beautiful lady, about 55. She is in the musics, in the arts, and very successful businesswoman, her and her husband, doing wonderfully, but just so grateful that she's lost weight, she's gained muscle, we've improved bone health, her hormones are balanced. Literally told me she has never felt better in her life. Then I stopped her and said, come on, in your 20s you had to feel better. But yeah, we giggled and had a good chat. The next person I saw, literally just chronic allergy, seasonal stuff, but she's here for prevention and was getting a vitamin IV. And then I finished my morning with somebody that really interesting case, because she came to me with MS and pretty significant, balance and gait issues. Very small individual that is 63, and so we had to work on weight, and that's difficult for some women. You got to get over the number on the scale. I'm like, look, we want to build bone, we want to build muscle. I want you, and we're going to screen you and do all these wonderful preventative things. But man, I want your life here on this planet to have good quality, not just quantity. And with MS and balance and bone, and she's kind of skinny and frail, I said, we got to work on that and build that. So she's literally, and this is a chore, she put on a few pounds of muscle, and the mental part of putting on a number bothered her, but we got over that, and her bone density improved. And what's wonderful is her last MRI of her brain with her MS, no lesions, improved. So we had some things we did with peptides, nutrition, hormones. Estrogen's beautiful for the brain. Estrogen will bathe the myelin of the nerves and can really help MS. She hadn't had a fall, even just a simple fall, in over 6 months, she told me, and she was doing awesome. And she's just such a pleasure to see, because we have fun, we chuckle. I work on trying to get her husband to see me, because she always tells me about his troubles, but we'll get there one day, one day. I say, just always tell him, I'm always here, and we're always good till we're not good. So, but I had somebody that we're working on some IBS. We had some improvements. She's had some surgical belly issues in the past, so that's compromising and complicating this a bit. But the reality is, a lot of her underlining IBS and all her labs were beautiful. Had a wonderful gentleman that is in his 50s that actually we're working on some of his heart health issues, all his numbers, heart strength, his inflammatory, lipids, all these things in his blood. He was just here on follow-up, are doing great. Had a young lady that really struggles here with anxiety and really things that don't make rational sense, but they're real. Okay, you can't judge anxiety; they're real. And the thing about her, because she's actually, I think 30 years old, maybe 28 years old, and she just struggled with growing up in an environment that it was highly stressed, and her mother was very anxious, and there was some turmoil with mother and father and that. And in our formative, really impressionable years, and studies show under the age of 5, when we live in this toxic or high, even if it's not intentional and it's still loving, it actually, because we live in mostly theta brainwaves when we're under the age of 5, which is like the dream state, or that's why children play and they're always happy and all that. Well, theta waves, though, are very impressionable parts of the brain. So the norm becomes living in anxiety. So you get this impressionable imprint on your brain of anxiety. So, she's dealt with this, and then her parents, when she was 18, got divorced. And then that really hit her. So we're really working on that. I actually got her going to see a therapist for EMDR, a great therapy that it's got really good science on improving anxiety. Got her on some supplements, and really working on some of this. And she's doing great. She's super healthy, but just we're working on some of that worry that's not rational. And I told her, what I really want for you is I want you to improve so that your children, she's about to have children, she's trying to get pregnant right now, don't develop in a household with anxiety and worry, because that vibration, that energy that's high like that will imprint her child. So I say, right now we stop this. We make generational change with the changes you're making. And so she'll do lovely. I have no worries about it, but we're still working on her. Had another gentleman, and this is great, gosh, we do this in-body. I have to cover up his name, but we do this in-body scale, bioimpedance scale, because we measure muscle, bone, and fat and that. And he's 60 years old, actually a young 60, doing great. Since I've seen him a few years, we started ago, he is down 50 pounds on here. He has gained 12 pounds of muscle, and he has lost 50 pounds. To be perfect statistically, he would only need to lose 6 more pounds of fat, okay? And this, by the way, this is how good this guy looks. He literally is 223, and he is 6'1". I mean, it's like perfect at 60 years old. So his numbers are great. We drew some labs. We actually did a lab on him for screening called the Gallery test. You've seen me do some other videos, hopefully on this, about early cancer signal detection for cells, cancer DNA cells. The Gallery test's amazing. So we drew that today. But I mean, how he's doing wonderful. And to do some reversal of conditions like he has are truly impactful and exciting for me to see. By the way, this guy's living large, traveling with his family, had a great summer up at Torch Lake, and still doing great business deals and excited about life and that, and looking amazing. And then I had another gentleman that I saw and followed up with, and he's about 70, and he actually, we just did a Zoom follow-up on some labs and that, and just kind of following up because he had some labs that were thinking about using a peptide called semaglutide for weight loss. It should work wonderfully for him because his insulin was high, and he's a little bit on that border of insulin-resistant pre-diabetic. And then we were judging some hormone levels on him because we do testosterone pellets, which have really helped his balance, his stability. He's gained some muscle, his energy's gone up. And often what happens, because he has Parkinson's, is that you can develop some depression, mood issues, and related and are connected to Parkinson and dopamine levels. And he's felt about a 30-40% improvement in mood and his Parkinson's symptoms. And yes, we're not going to cure Parkinson's, but we're helping his function. He's doing amazing. A lot of numbers are getting a lot better. His strength is better. His energy is better. I take care of a lot of executives, a lot of businessmen. Him and his son bought a plane, and they're traveling, and they're planning a trip to actually go overseas to Europe in a few months. So I'm excited for him because he feels great and he's getting some strength and mobility back. And we got him on a few supplements too that do work very nicely to elevate dopamine in the brain and help Parkinson symptoms and Parkinson-like symptoms. So this is great for Terrence. And I think he's just going to continue to do better. And then I had a great, phone call today. Reason is I ran into him a few months ago, but I think you can see in the background, I take care of athletes and entertainers and stuff. And it was a ex-pro boxer, world champion, wonderful guy. I don't want to say his name, but a beautiful soul. The reason I say that is he still looks, he's 65 years old. He still looks as good as he did when he was in his 20s and 30s, still sharp and everything. He actually, after boxing, got into politics in Detroit, and great guy. I ran into him at an event a few months ago. I hadn't seen him in years. My wife said he looked better than me. He's a good looking guy. And anyway, long story short is he's like, Doc, I need to get into you. He wants me to help him with his sinuses and some allergy issues that he's got. And funny thing is he wanted to make sure that I'd see him because of his age. And, he hadn't seen me and seen a doctor in a while. And I said, of course. I'm here to help. So that was exciting because we caught up on some old times and that, and it'd be a pleasure seeing him. But listen, this message is just to empower you that you can improve your life and your quality of life. And the most valuable currency there is not money, it's time. What we ultimately do here is work on extending time, extending quality and quantity for you, extending and improving so that you can enjoy life, you can love, be loved, and still do good things, okay? And God willing, we'll continue this journey because that's what life is, and just having fun and loving each other, okay? So this is Dr. Lorenz speaking for Dr. Abood. He's one of my docs here, and my 5 other practitioners and our locations and that, and we just love what we do. We're passionate about what we do, and we love taking care of you. So appreciative, do the right thing, and be well.